Welcome to the Explainer. We've got a lot to get through, so let's dive straight into the intense pressures facing our public services in Ireland right now. For the working family here in Ireland, the reality on the ground is pretty stark at the minute. We're talking thousands of us stuck on long waiting lists, ringing the GP first thing in the morning and still getting absolutely nowhere. That's the real lived experience, and let's be honest, it is a massive squeeze. There's a massive divide going on between our immediate, everyday frustration and the incredibly slow-moving reality of government planning. Think about it. You need a doctor today, or you're trying to sort a school desk for the young one by September. But the system? That operates on multi-year timelines. It's a fundamental disconnect between the pressure we feel today and how the state actually builds for tomorrow. Section 1. Healthcare under pressure. Let's diagnose the squeeze. Because, to be fair, this is where the strain feels most obvious to all of us. Now, looking at the underlying factors is absolutely crucial to realize that even without recent inward migration, our system would still be buckling. We've got an aging domestic population and years, decades even, of historical underinvestment. We're living longer, which is grand, of course, but it means much more complex, ongoing care. This pressure has been quietly building up in the background for years. So here's the thing. Healthcare capacity relies on very specific pillars: staff, hospital beds, funding, infrastructure, and system efficiency. It is a completely rigid equation. If any one of those elements lags behind the demand, immense pressure builds up across the entire network. You can't just throw in more hospital beds if you haven't got the nurses and doctors to safely manage them, right? And here is the actual bottleneck laid out. Population growth naturally adds demand. More people simply means more patients. That's just a fact. But it's step 3, stagnant capacity, that turns perfectly normal demand into the severe system strain we feel at step 4. The demand is just doing what demand does, but the capacity is what's failing to keep up. Section 2, the squeeze on schools. Let's look at the localized pressure unfolding in our primary and secondary classrooms. It's really important to see that this isn't a single factor issue. Both domestic population growth, our own kids coming up through the system, and inward migration are driving up school demand at the exact same time. They're both rising, and that's putting a massive squeeze on our urban centers where space is already at a premium. When schools have to scale up faster than their multi-year planning allows, it leads directly to larger math classes and relying heavily on those temporary prefabs out in the yard. Educational planning takes years, so rapid changes in the local population create intense short-term pressure on working families, even if a long-term expansion is officially on the books somewhere in a government department. Now, this is a concept we really need to get our heads around. It is vital to understand that population growth isn't spread evenly across the country. The pressure is highly localized, hitting certain communities far harder than others. If a specific town experiences a sudden population jump, local GP availability tightens instantly, and the schools feel it straight away. Meanwhile, another town just down the road mightn't feel a thing. Section 3. The tax imbalance. Let's talk about funding the system, because at the end of the day, there's no magic money tree. These services rely directly on the tax pipeline. When new arrivals come into Ireland, it creates a very real, temporary imbalance. The demand for services is immediate. If you're sick on day 1, you need a GP. But there's a natural, built-in delay before people enter employment and actually start contributing to the tax net to fund those same services. What this means is that short-term demand spikes much faster than the funding adjusts. And that is exactly why working families feel that sudden, sharp squeeze on their local services. Long-term tax contributions may eventually balance the books and offset that gap, but the lived experience on the ground during that delay is undeniably tough for local communities. Section 4. Capacity versus demand. Let's bring this all together to clearly separate the symptoms we feel from the actual underlying disease in the system. If this were purely a demand issue, the focus would just be on reducing that demand. But because it is fundamentally a capacity issue, the real, lasting solution requires expanding the supply of our services. You can't just try to wish away demand. You have to build the capacity to handle reality. The most accurate way to frame it is this. Population growth absolutely increases demand. There is no denying that at all. But it is the rigid capacity bottleneck that determines if that demand turns into a full-blown crisis. If planning and investment don't keep pace, the pressure just becomes a persistent, exhausting reality for every working family trying to use the system. As the source material points out, blaming a massively complex, historically underfunded system entirely on immigration is a bit like one of those brilliantly confident misunderstandings you'd see in Father Ted. It's a very tempting narrative, it's nice and simple, but it completely ignores the layered realities of how our state infrastructure actually functions. Which leaves us with one massive lingering question. Does immigration actually result in a net cost or a net contribution to Ireland's finances? Join me in the next explainer, where we're going to break down the taxes and the welfare to find out. See you then.